I think there's still, at least from my perspective, I think there's still a lot of veterinarians that are nervous about doing the wrong thing, which is very true. And I think that is true of everyone, right? That's human nature to be nervous about doing the wrong thing. And I think that people are very nervous about that when it comes to stones.
Welcome to the Purr Podcast, your favorite feline-focused podcast, where we dive into all things feline, medicine, surgery, behavior, and of course, a sprinkle of veterinary gossip along the way.
I'm Dr. Jolle Kuppenstein, feline fanatic, surgery nerd, and self-proclaimed lover of all things awkwardly cat-related.
And I'm Dr. Susan Little, proud cat vet, podcast enthusiast, and your guide to the wonderfully weird world of feline medicine. Let's get started. Hi, this is Dr. Susan Little.
And Dr. Jolle Kuppenstein. This is the Purr Podcast.
Oh, you're using your FM voice.
I did.
It's an FM voice.
I did. So
I just
wanted to
wanted-
throw it in early in the.
I want it on record that
Thank you.
I used an FM voice first.
When?
Well, a year or two ago.
Oh yeah, that was not a success.
It was a success. When I get it right, my FM voice is pretty good.
Oh,
Yeah.
Okay, we were talking about urine.
We are delighted to continue our conversation with Dr. Allison Kendall, who likes pee.
Mhm.
Yeah.
And last time we talked about your career, how you slowly rolled into the urinary world,
Or
and
sunk
how-
into
and-
it.
yeah.
Dived into it.
and
Sedimented
dove
into it.
into it. That's it. That's
There's a
it.
lot.
So,
Yeah.
Right.
Yeah,
right.
You could do it.
And
Yeah,
there's and we emphasize how important it is for cats because it is the
Mhm.
number one and number two disease that comes into the veterinary clinic. So everybody's talking about it. We ended a little bit about radiation, which probably not a lot of people have. It's completely novel therapy for FIC. And I think Dr. Susan had another question about it.
Yeah. So is it one treatment or multiple treatments?
It's one treatment as of now. Yeah.
One
So
treatment.
we are just following them out. So we have our first cat was treated about 5 years ago, and that cat is still doing well.
That is amazing.
So unsure if it will turn into a multi-treatment thing, but as of now, just one single treatment.
It's a little mind-boggling though, isn't it?
Right.
That
It is, yes. So it's still really kind of blowing my mind away. So our first study that we did was truly just a pilot kind of proof of efficacy safety study. And so, we just took 15 cats, male cats that were, otherwise facing euthanasia. Like these were really tried to get cats that were really bad. And one cat in particular that was in the study had 4 urethral obstructions in the past year. And so we took really pretty severely affected cats and treated them just to, see, kind of would this work? And we kept everything, in addition to environmental modification and stress management, and had them do all the normal memo. And really the only thing we changed was if they got radiation. We took these cats with urethral obstructions, and mostly we just wanted to see, will it reduce the recurrence of blocking, so that
because that's what kills them.
exactly. And so that was kind of the idea for the project and what we were looking at, and didn't realize that it was going to really treat their pain and their FIC too. And so all 15 cats are still alive.
Wow.
And they were treated years ago, and most of them have had no recurrence of their clinical signs at all.
So why do you think it's so efficacious?
I think because it's treating their pain so potently and rapidly, because I also think we don't have really good pain control options that target the bladder, and we don't have really good pain control options for cats. And so I think that it is, controlling the stress. And then because I think what's happening with these cats is that they're stressed, they're manifesting pain, that pain is making them more stressed. And so then I also think that giving them oral medications, oral pain medications, most of these cats are already stressed out, and then you're
Right.
trying to medicate them.
You're
And so
layering stresses.
you are,
yes.
yeah, which I think is what's made FIC so challenging to treat.
Mhm.
And this is kind of a minimal invasive treatment, so
Yeah.
you only do it once. Can you give me a little bit of a detail? So is it's one shot of how much do you give. And you said you had to hit the whole urinary tract, which means also the urethra and the ureters, or is it just the bladder and the
Just bladder and urethra.
Right.
Okay.
So it's one dose of 6 gray, so it's a pretty
Okay.
low dose.
Right.
Yeah.
And yeah, I think it's just so rapidly anti-inflammatory, anti-pain, and then they go home and we continue all their normal environmental modification. And it's kind of like we broke that cycle
Right.
of
Yeah.
pain and stress. And so
Yeah.
it's allowing them to be treated more easily.
And,
Are there
Mhm.
centers doing that now that?
So there are quite a few referral centers. So there are quite a few different vet schools that have, there are still a lot of radiation oncologists and specialists that are waiting for the paper to come out, which
Okay. Yeah.
really hoping I can do it this
Yeah,
year.
yeah,
It's
yeah.
that is my that's on the very top of my to-do list is
Everyone.
to write this paper and get the publication out so that more people can offer
Yeah,
it.
sure.
And we can continue to see, does it actually work, and are we actually really seeing this dramatic of a response?
Yeah.
And what
So-
is the ideal pay? So are you now proposing that every cat with FIC should be placed on this therapy, or
Yeah.
is it really the difficult cases?
No, I think should be reserved more for the difficult cases, but I think it should be reserved because, one thing I don't want people to think is that their cat's going to start showing lower urinary tract signs and we're going to treat them for radiation. Their cat's going to be cured.
Right.
Like
If you don't fix
it
the
is
other stuff.
exactly. It shouldn't be looked at like as a sole curative treatment. It should be looked at as another treatment to have kind of in our arsenal.
Right.
And so that's what I want people to think of it. And so I tried to reserve it for cases who they've done all the environmental modification and they've done it appropriately, right? So we now at NC State have an FIC cat clinic. So we have these cats come in. And when I sit down and actually talk to them about memo and the environmental modification, so many clients and I think veterinarians are telling owners to just do, just like the 1+1 litter box rule and kind of ending it at that.
That's
And
it.
it goes so much further than that.
Mhm.
So I think
And it takes time to do that, but
it does.
a bit in defense of GPs, right?
Yeah. Oh yeah. It's
a time.
Oh yeah, I totally agree. I think I think one of the big things we still need, and I think we're getting now that cat interest is peaking, is more resources to send to clients. We have some good websites, like the Ohio State has their website. There's new cat aggression guidelines that have come out.
Yeah.
So, I think because I totally agree with you. I think there's such long, nobody out in general practice has an hour to sit down with a client and go through all the different environmental things. So if we can get more resources that are aimed at clients to say, here are the things that you need to be doing for your indoor cat and meeting all of these marks, we can send those to clients and make sure that they are meeting those marks.
But it strikes me. So you said you have an FIC clinic now. There are probably many veterinary hospitals who just through managing their schedule a bit could say, Dr. So-and-so who really likes working with FIC sees FIC patients on, so it's not impossible to have some variety of that. So that way the cat sees the right person.
Yeah, I agree.
Right?
I agree. Yeah. And when I've lectured on FIC, I think getting your front staff involved too, so that when they see an FIC cat coming in on the schedule, maybe that's a good time to send the client these websites and all these other, and there's also
Prepare them.
Yeah, and even Tony Buffington, Jody Westrop have really nice client surveys that you can send to clients. And so if you can send that out ahead of their appointment, then you can use your appointment time more
efficiently. Agreed.
And so that's one of the things I think you can use your whole staff to be on board for.
So let's switch to another topic, Dr. Susan. You want to know about stones, and we know certain stones can be treated very easily, but we really want to focus on the stones that can't.
Now I have to give you a bit of history because the very first episodes, I think the first three
in Brazil.
so we recorded the first 3 episodes in Rio de Janeiro in 2018. As I look over at Stacy, our communications manager, yes,
Right.
in 2018. And it was a crazy idea Yola had when we were lecturing in South America, and we needed a break, and we checked ourselves into this lovely hotel in Yola. And I'm like, oh, thank God. And Yola's like, well, I have this idea, so we're going to spend the whole day.
Yeah.
So the first 3 episodes were on Uroliths.
Oh, interesting. Yeah.
Yeah.
Right,
Yeah.
right.
So
And
Yeah.
the main reason is that we know from Minnesota Urolith Center.
Yeah.
A big shout out to Jody, and they're both Jodys, by the way, because they both do a lot of work at stones. But 50% of all the stones that are sent there are struvite stones,
which is
and
just
that has not
shame.
changed
Yeah.
in the last
Yeah.
20 years. So
This is
Yeah.
we just got the 24 data,
Yeah.
and it's still
Still.
50%.
Yeah.
So we're doing
this is
something
crazy.
wrong.
Yeah.
But I do think that's the reason that I want to focus. So of course, if you have a struvite stone, you need to use a diet,
Yes.
especially in cats.
Yeah.
But I think a lot of people are worried about the other stones, calcium oxalate and anything that they cannot dissolve, because then they
Yeah.
get stuck and blah blah blah. So can we
Yeah.
hit the darkness around these stones a little bit?
Well, and I think that is a good topic, because that's actually one of the topics I lectured at BMX on Sunday was stones, and I focused a lot on stone prediction. And
That's good.
I think you have to be able, as a clinician, to look at the information you have with your radiographs and your urinalysis, and you can almost always predict what the stone is. You don't have
We
to
have an
remove
app.
it and wait for the
We have an app
analysis.
for that. too.
Exactly. And there's an app. There's so many
Yeah.
tools that we have.
And really,
Yeah.
all you have to do is decide struvite or not.
Exactly. Yes. Because struvite, dissolve them. You don't need to remove them. You can dissolve them.
So why is it tough to, because the app has been around for a while, and we've known you don't need to do cystotomies on cats with struvite stones for so why is it so hard? Why
I
is it
don't
so
know.
hard?
I think
It's a frustration.
it is. Yeah. And I think there's still, at least from my perspective, I think there's still a lot of veterinarians that are nervous about doing the wrong thing, which is very true. And I think that is true of everyone, right? That's human nature to be nervous about doing the wrong thing. And I think that people are very nervous about that when it comes to stones, that if they don't remove them, that either, maybe they're missing the diagnosis, or people are also very nervous about stones causing obstruction, because then you're in an emergency type scenario. But I also think we know that just because they're in the bladder does not mean that they're going to obstruct. And there's lots of research on that to show that too. And that they're not more likely to obstruct with dissolution.
So I asked Jody Lulich that question because after lectures, vets would come up to me and say, but aren't you worried, as the stone breaks down?
Yes.
So I asked Jody, and he said, I don't have an exact answer for you, but if you look at all of the studies since anybody's been doing dissolution studies with whatever diet, there's no record of cats blocking while on a dissolution diet.
Yeah.
And I'm
And
like,
then,
okay.
and then
Yes,
the funny thing
I
is
agree,
that you
yeah.
always get a veterinarian, but one of my cats did it, right?
Yes,
So there
maybe.
is this
Yeah.
if you have one case, that doesn't mean
Yeah.
that all the
No.
and Jody said,
Right.
I have not seen one. And
Yeah.
he sees hundreds
more
of
than
thousands of
that.
cases that,
Yeah.
and so that's a little bit. And then you also have the mixed stones, which could be a reason
Yeah.
to have not a 100%
Yeah.
success rate with
But it's
dissolution.
it's fear-based closure, right? And I think that we practice that, and I tried so hard to get the students to not think about that, but it's hard. It's human nature that they have one case that goes bad, and they have 49 cases that go well, and they're always going to practice their medicine based on that one case that went bad.
That's a
Look,
good
the
point.
first cat I
Yeah.
ever gave Medicam to got a bleeding gastric ulcer, and it
Mhm.
took me months,
to ever use it again.
and I've never
Yeah.
seen that happen again.
Yeah, it's fear-based medicine,
Yeah,
right?
that's a really good point. I
Yeah.
always add to the fact that people like this surgery. That's
Yes.
a little bit the
I
bad
do think
news
that
here
too. Yeah.
Well,
Yes.
but
So-
look what the cat
Yeah.
goes through.
No,
I think,
I'm
I
totally
think-
with you.
yeah.
I'm the surgeon
Yeah,
that is
yeah.
most against this surgery
Yeah,
ever.
Mhm.
But then I always say I want to eradicate it. I
Yeah.
want to
Yeah.
eradicate it in 25, didn't
Yeah.
work. 2030 is now my goal. That we don't do this.
have to shift the goalpost.
Yeah.
Right, but still, people like it's.
Yeah, they say, oh, well, cystotomy is really quick and
It's quick and easy,
but quick
they-
and easy for you.
Right.
Yes,
Yeah.
I think you're
Exactly.
exactly right. They're not.
And we
factored
also, I
in.
think all the information that's coming out of Minnesota about suture-associated uroliths that still blows my mind. I mean, it's 4% of recurrent stones in cats, and the last I talked to Jody Lulich was that they think that number's higher.
Oh, yeah,
even.
yeah. Right.
That recurrent stones from suture material. So
Yeah.
I
He
agree.
has this beautiful test that he puts a little suture into his
Yeah.
suspension and whoop, we see it crystallize.
Yes.
It's just like,
yeah, it's
wow.
wild.
But
It
that's
makes
a technique
sense.
thing. It's
Yeah.
a technique.
It is.
solve.
So let's talk about calcium oxalate because that is
Yes.
the real problem in
Yeah.
cats.
It is.
And it's, we always say 50% struvite, put them on a diet. So as a matter of fact, Susan and I, we say any cat that you have, you put them on diet for 2
Mhm.
weeks, see if they get smaller. If they get smaller, keep on going. If they don't get smaller, you take them out.
It's,
Yeah.
it's not like it takes a long time to tell.
Right.
If you're on the
Right.
right track,
Right.
so.
Yeah.
Right. So, but the calcium oxalates are a problem, and we have talked with Jody in length about
Mhm.
where do they come from, why they're there, but it's still not 100% clear with cats.
hmm
So, what is the golden answer here? How can we prevent them? I think we have now
Mhm.
diets that don't cause them as much.
hmm
I think that is really good.
Yeah.
But still, they still occur quite a lot.
Yeah.
Right.
Well, and we also, same thing, we know that those are more likely to occur in indoor cats as well too. And I think part of, diet, hydration status, all of these things play a role.
There may be some genetically predisposed stone formers.
Definitely.
Right.
Yeah. Yeah.
I think Jody had a really interesting, and he's still to prove that there's also linkage to the kidney
Yes.
and calcium oxalates and calcium oxalate formation in the kidney,
Mhm.
and then, the cascade down to the
Right.
bladder.
Exactly.
And we know that calcification.
As long as they get to the bladder and don't
Right.
obstruct on their way.
Right,
Yeah.
right. obviously.
Yeah, absolutely.
obviously.
Yeah.
It's such a difficult disease.
It is. Yeah.
So we're always in the, fixing when it's too late mode,
Mhm.
and we really should get them earlier, either in the total prevention mode, which we can do, or
Mhm.
an easier way to treat them instead before they get major complications like obstruction and so
Yeah.
on. Right.
Exactly.
Yeah,
Agreed.
but even if you get that far, they are very likely to recur, right? Like it's
Mhm.
more likely for a calcium oxalate to recur, I think, than
Yes.
struvite. So
Yeah.
there's still something.
But I also think with the recurrence of calcium oxalate stones is that I don't think we are doing a good job at prevention.
Mhm.
And that's where I've tried to shift people's mind to too. And when I talked at VMX as well, is that, I see so many people so many animals, cats too, that come in and they're like, well, I've put them on a urinary diet. They shouldn't be forming stones anymore. And then I run ionized calcium on them, hypercalcemic, right?
Yeah.
So I think there's all these other things
Yeah.
that we're forgetting to treat and put into our prevention plan. And it's not just putting them on a urinary diet and calling it good. Like
Right.
we've got to look at all these other comorbidities
You're
that
right.
they have.
There's a lot more idiopathic hypercalcemia out there in cats than anybody knows.
Yeah. Oh yeah.
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 You don't look, you don't see.
Yeah. Exactly.
Yeah. So
Yeah.
I think that's really important to check that when you have a calcium oxalate.
Mhm. And there's
So for
specific gravity, so many of even though they're on a urinary diet, all running, their USGs are greater than 1050.
I know.
And you're like, well, we need to get that down too.
Right. Any other crazy stones that you see often?
We see a lot of cystine stones lately, but that's in dogs, so we don't have to go there.
Right. That is.
But
Yeah.
cats, but definitely calcium oxalate struvite.
Right.
So
Do you know, so I know this from the Minnesota
Mhm.
Urolith study data, and we have listeners from all around the world. In other continents and other countries, this calcium oxalate and struvite is not always true around the world.
mhm.
Right? I think Europe is a lot similar to us.
Yeah.
But there's a lot of countries, I think South America is a good example where their most common types of stones in cats are different. They see a
Yes,
lot more
yeah.
different stones, right?
Yeah, exactly.
Yeah, so there's obviously, and maybe that's all to do with
Mhm.
nutrition, who knows?
Environment, hydration,
All of
yeah,
that, right?
right.
Yeah, but it's not.
I think for the other species, that's correct. For the cat, it's not.
No, it is.
Because if you look at the data that Jody showed.
You look at South America.
Right.
It's different from.
Just maybe the level of calcium oxalate versus struvite, but it's not
They
that
get
cats suddenly get all sorts of other stuff.
No, they get way more purine and cysteine stones in South America than we do. No, it's markedly different. Yeah.
Right.
Yeah.
We'll
Which is
pack
curious.
some data on to the.
Well, yeah, we can just,
Right.
we'll link to the latest Minnesota Urolith
Perfect.
data, because I find that just fascinating.
Yeah.
I do know that in the lesser species that in areas where there's volcanic activity,
Mhm.
that they have a higher incidence of these whatever stones they have.
Mhm.
And
They also
it's
get a lot of
liquid.
purine stones
Right,
around volcanic
right,
activity.
right,
Yeah.
right, right.
Really?
And so because they think it's
Yeah.
in the drinking water.
Yeah.
It's silica
Yeah.
stones, those were the ones.
Yes.
Yeah.
So suddenly
stones and
you
then-
see silica stones in areas where there is volcanic activity because it's probably in the drinking water and people get it, or animals get a higher level of silica.
I've had owners ask me, should their cat drink like filtered water or bottled water instead of tap water? What do you think about that?
I don't know. I feel like I
don't
get
know the
that
answer.
question. I don't know the answer to that either. I think it probably depends, right? Like, I mean, really, you probably should then have your water tested and see what's in it
Before
and
you
then-
would
yeah,
make that leap.
yeah, exactly. So
yeah.
most people's water is probably fine, but if you're
You would think.
yeah, I would think so. Yeah.
Once
You would
again,
think.
bottled water from volcanic regions probably is not
Yes,
so
it
good.
does.
Right. Where does the water come from?
The Fiji water
Right.
is from volcanic.
No.
So
Right.
yeah, so that is high in silica too.
Yeah.
There you
so at
go.
least don't
Learn all sorts of
use
stuff here.
Fiji
so-
water.
so-
Yeah.
So we talked about stones, we talked about FIC. What would be the
Mhm.
number 3 issue that you see in cats?
Ooh.
Oh,
Lower
well,
urinary.
I mean, probably ureteral obstructions, but I guess that goes along with FIC. And then, I mean, I see a lot of feline incontinence, but because
that's interesting.
they come to me for that.
Right,
So
right.
Oh, so tell us about
Yes, that's
feline incontinence, it's a tricky one.
that. I think
for
it's
sure.
a minefield, and that's
It
all I
is.
know.
Yeah.
Right.
Yeah.
Oh, thank you, Dr. Susan. That's very
yeah,
It's
helpful.
complicated.
Yeah.
It is.
So is there a particular type that you're seeing or?
Well, I think you have to think about it in the same way that you think about it in the other lesser species.
Right, so canine incontinence,
yes,
we can say
yes.
that. So the word canine, you can say what this is too.
Okay, I think when people see an incontinent cat, it's like all of a sudden their head explodes and they can't
Mm.
think anymore.
Right.
But I think if you think about it with the same concepts that you do for canines, you can work your way through it. That was one of the things I was the lead author on the urinary incontinence consensus statement, really trying to break down incontinence and make it easy for people to think of. And I think, the biggest thing is looking at it, is it a problem with urine storage? Is it a problem with
Right.
urine voiding? And that's relatively easy in cats because they're so easy to palpate. So you can easily palpate their bladder and be like,
True.
do they have a small bladder? Do they have a big bladder?
And is it expressible?
Is it expressible? Is
Right.
it not easily
True.
expressible? So you get so much for cats with their physical exam.
Mhm.
I think
And
I've
then-
ever seen one ectopic ureter in a cat.
Yeah.
It's not very
I
common.
don't see very many ectopic ureters. I see more urethral, so either urethral strictures, partial urethral obstructions. I also was interested. I have seen a lot of cats recently in the last year that are incontinent because of pain and osteoarthritis.
That's
That
a
I
good
think
point,
if
right.
they,
How does that?
yeah, because I think they end up getting a voiding disorder because they don't,
It's like an acquired voiding
exactly.
disorder.
So they don't posture long enough
Right.
to urinate, and because
Right.
we're so terrible at picking up pain in cats.
Right. So they might not fully void.
Exactly, that when they go into the litter box,
Yeah.
it's too uncomfortable or too difficult for them to
That
fully
makes so much
void.
sense. That makes so much sense.
Um,
But I would
well-
also say that in people at least, you see incontinence also with bladder issues, especially bladder inflammation, bladder, infection.
Yes,
Okay, infection is not so common in cats except
Right.
for older cats.
Yeah.
But wouldn't you expect if you have idiopathic cystitis that they would get incontinent? Why is that not happening?
well, idiopathic cystitis, they would probably be more of like a storage disorder because
Right.
they're more plaquuric.
Mhm.
and they're not holding in their urine quite as much.
Right.
I'm
They're
talking
voiding
about
every
yes,
teaspoon.
exactly.
Right.
They're actually voiding too much.
Right, right.
The ones I'm talking about are the cats with like significant hip discomfort or spinal discomfort, and so they go to posture, they pee, they get uncomfortable, and so then they stop. And so over time, as they withhold more urine, their bladder gets more
So
stretched.
they have all stretch type junctions or whatever.
Yeah,
you
and
call
those are the
them,
ones
right,
that have like a large flaccid bladder when you
Right,
palpate
right,
them.
perfect.
So it's your detrusor atony after urethral obstruction type
Exactly.
of mechanism, right?
Exactly. Yeah, but it's
Okay.
happening chronically over time.
Yeah. Okay.
Yeah. So I've seen with some cats that then their incontinence improves once we put them on better pain control, because then they're posturing better
They
and they're
can
able to
void,
void
and
and
over
empty.
time.
Exactly.
So the wise lesson of this podcast is don't freak out if you get a cat with
Yeah,
urinary
yes,
disease.
yes,
Incontinence, I
don't
love
freak
that. I
out,
love that.
yeah.
Freak out.
I
Yeah.
would never have made that connection. That's
Yeah.
Right.
but
So,
when you think it through, it makes total sense.
Yeah.
so stepwise is you feel the bladder if it's small, if it's flaccid and large. So what do you do if you think it is that?
Well, I mean, the biggest thing for cats though is getting a really good neuro and ortho exam. And I feel like we're terrible at getting those in cats. Like we rarely ever.
I've been a vet
You-
for 30 years and I can't do an ortho exam on cats.
Yeah,
It's
it's
one thing they won't walk.
right, exactly. It's hard. It's challenging. And so I think over time you then just forget to even do it. But I think it's really important when you have an incontinent
Right.
cat.
Yes.
Because the other thing when we look at incontinent cats, over half of them too is actually neurologic.
Yeah.
And usually it's spinal cord injury.
Yeah, yeah, yeah.
That has gone undiagnosed too.
Yeah.
That
Yeah.
makes sense. That makes
Yeah.
total sense. So,
Yeah.
and then therapy wise, what do we have for cats? So
Well,
you have to
it
treat the
depends, yeah.
pain, you have to treat
Yes.
the underlying, but if it is something where you need to stimulate the bladder to work a little better.
Well, that's where it gets a little bit challenging. So you can, I mean, bothanicol doesn't really work in canines, but it certainly doesn't seem to work very well
And
in
it
cats.
makes cats feel really crampy.
It does. So I don't usually recommend using bothanicol at all.
Right.
I think using something to relax their urethra so that they can at least have a relaxed urethra when they
Right.
go to void, treating their pain,
Do you
relaxing their urethra.
think prazosin works?
So prazosin, I think it works when you look at a cat's urethra, the only the proximal urethra pre-prostatically is smooth muscle.
Yeah.
And so it's
Yeah.
a very small amount of smooth muscle, and then the rest is striated
Striated.
muscle.
Yeah.
So I think, and you don't know exactly where the spasms occurring.
Exactly. Yeah.
So I always tell people, I think if you can give a cat prazosin, it's worth a shot and see if maybe some of the spasm is occurring in the smooth muscle.
Right.
If it's too difficult to medicate them, then may not
Yeah.
be worth it. But instead, we're using more striated muscle things, which also gets challenging in cats. Like we
Yeah.
just don't have a lot of
So that
options.
would be the benzodiazepines or
usually
yeah.
either, but that's typically what I reach for is a
Yeah,
benzodiazepine because
okay.
that's really most of our
It's
options.
yeah.
Yeah.
We're pretty limited.
Limited, exactly.
Yeah. Same ones we were
Mellows
using
them
20
out a
years
little
ago.
bit too.
Yeah.
So,
Yeah,
they're not
exactly.
thinking about it as much.
Exactly.
I have to be, I don't want to because it hurts. So,
Yeah,
but, and do you give them pain medication?
I do. Yeah,
So it's
Yeah.
always combined with pain medication
Yes.
because that makes a lot of sense.
Yeah.
Right.
yeah,
Especially if you have signs that it's the joints that give them a little bit of an issue.
exactly.
You know, Dr. Susan always points out that we forget when cats get older, we forget that they cannot walk up things as much. They cannot
Mhm.
climb into the litter box as much. So
Yeah.
that only might be a reason why a cat is not peeing as well, because they
Mhm.
cannot get in and they cannot get out.
Yeah.
So you need to
Yeah.
adapt to an older cat with
Exactly.
joint disease. So,
Exactly.
right.
Yeah.
A nightlight by the litter box. they
Yeah.
say.
Yeah.
Right. That's
You
it.
put them in an easy, accessible place.
Yeah.
Yeah.
This has been wonderful.
Yeah,
Thank you so
thank
much.
you.
It's so cool.
Yeah.
I could not have imagined that we would be talking about cat incontinence. So
Yeah.
and we
I
learned.
think
Yeah.
you're the first person
I know.
in over 200 episodes.
I know.
Right.
That's so amazing.
Who's
And
even
I
said
talked about
incontinence.
right. So that's the advantage
Yeah.
when we get podcast virgins
I
in
know.
our show because they bring a new thing, and no, it has been lovely. It's
Yeah.
we like talking about urinary disease in cats
Yes.
because, like I said, we want to stomp out those truvites.
Yes.
Yeah.
But there's so many topics that we
Still
can
a lot of
talk
work
about.
to
Yeah. Yes.
Awesome. So thank you so much.
Yes, you're
Yeah.
welcome. Thank you.
This is the Purr Podcast, where we talk cats, laugh a lot, and learn something new every episode. Together, we bring you the latest updates, surprising cases, expert interviews, and just a touch of chaos, because nothing with cats ever goes as planned.
So whether you're a seasoned veterinary pro, a new grad, or you're just here for the cat puns, you've come to the right place.